1996. Good morning, everybody. It is 7:44. Welcome back to the program. Blue and Jackie here, and we have our friends from the ENT Clinic of Iowa joining us in studio once again. Dr. Hoisington made his way back to the studio. Hi, Doc.
Hi,
how are you?
Appreciate that very much. And we also have Jennifer Ryko joining us this morning, and we're talking allergies.
Yes, we are today.
So why is this such an important topic at this time of year? Because I don't know about you guys. I usually don't suffer from allergies. I don't know if it's the weather, things blossoming, but I feel like I'm being affected by what would we consider allergies this year more than ever.
Well, this time of year, it's difficult just because the amount of humidity in the air makes it more difficult as far as breathing and stuff. And then a lot of the plants that we have now are in full bloom. So the grasses, end of tree season. Now we're moving into weeds. So ragweed will be coming up here shortly. About the 1st of August is usually considered ragweed season, and then we'll be heavily into weed season until we freeze in the winter. And then with the harvest and the farmers pushing everything into the air, it'll be even greater at that time.
Now, what about people that may not have suffered from allergies for the majority of their life, and then all of a sudden they're saying, you know what, I think I'm going to getting allergies is what they say. I think I'm getting allergies.
I see a lot of people, like I just saw a lady yesterday who was surprised by the number of positives she had on her allergy test and swore up and down in her initial visit that she didn't have allergies and it wasn't an allergy problem.
So what would you attribute that to?
I think more it's, when I look at it, is that people have a tendency to tolerate things when they're younger. They also have mechanisms that allow them to tolerate things when they're younger. But as they get older, the mechanisms that allow you to tolerate things don't always work as well. So I always tell people aging is a state of physiology. Your mind tells you you can do anything you want, but your body reminds you the next day of why you probably shouldn't have done it in the first place. And so that's kind of
that's a great way of explaining that.
So
that's the most logical explanation I've ever heard.
So what are, if people are obviously I think we all kind of know what allergies are, but what are some typical reactions if people are like, oh yeah, maybe I do actually have an allergy?
Well, it's different for different people. I mean, there's different target organs. Like the most common one people know about is the nose, where, you know, I'm congested, I have a runny nose. You know, it always feels like I have a cold. Then you talk about the throat, where it's itchy and it's scratchy. Some people have ear symptoms where they feel like their ears are full, they can't pop. You know, some have lung symptoms, which allergies and asthma kind of go hand in hand with reactive airway disease. So it can run a gamut of different things from being very mild to very severe, and it's true with most disease processes. It's not one fits every person. It's kind of individualized to the person and how they react.
All right, now the important thing is, what can we do about it?
Right.
Well, I'll let Jennifer say some things, because she's actually runs the allergy department. I kind of just show up and do my thing.
Do we have any idea of how many allergies there actually are, or that people can be affected by? Is that even possible?
There are a slew of very common allergens, especially in the Midwest. And like Doctor said, right now, high primetime grass season, but we're moving right into the weed season. And it's usually right around that 1st of August or right when the fair starts.
I was going to say fair time, isn't it?
Yeah, that is the time where ragweed just goes through the roof and people start feeling more symptomatic. And it's interesting, you know, along with Doc, the more exposure that someone has to different things in the environment, whether it's something that you're breathing in or it's something that you're ingesting like a food, or maybe it's a medication that you're taking, some people are a little more predisposed to developing allergens. And once your body is sensitized to something in the environment or something that you're eating or a medication, the more exposure that you have over time, the more severe symptoms that you have. So,
seriously? You think it'll be just the opposite?
Yeah, well, you know, there's studies out there that show that too. But treatment options, I guess, when a patient comes in to see us in the allergy department, they've already had a workup by Dr. Hoisington, and he's pretty much, I mean, he can look up in the sinuses and based off the history, determine whether or not allergy is a potential factor in the symptoms that they're having. So by the time a patient comes to see me, we do the full allergy testing, the boards, the trees, weeds, grasses, molds, some dust mites, some animals, and depending on what other exposures the patient may have, we can tweak things a little bit so that it's customized for that patient.
Okay.
And we can find out exactly what their triggers are and how sensitive the patient is to those specific triggers. In the end, making the whole immunotherapy experience very tolerable and customized for that patient. So it minimizes the amount of time that they're on immunotherapy, like allergy shots or sublingual drops is another treatment option that we have in the office. We're also involved in a study right now. It's a transdermal form of immunotherapy. But the way that we're testing at the office with the skin, it's allowing Dr. Hoisington to really customize that treatment for the patient and really gain control of the patient's symptoms effectively and quickly.
How long does a treatment usually last?
Treatment usually lasts about, they say 3 to 5 years. A recent study that came out last September said, you know, if you can stick it out for 4 years, you're going to have more long-term benefit from the immunotherapy. But again, every single patient is different, so we're looking at the individual, not just a cookie cutter.
I was going to say, so instead of going to the local pharmacy and signing a waiver and getting the pill that kind of helps you breathe a little bit better, it might be better to go in and see what specifically is ailing you and treat that specific thing.
Right, I tell people, look, you weren't born with a bag of decongestant on your hip to take every day so you can breathe. So if you're having to do that, then there's obviously something that's causing a problem for you. And those medicines are okay for short-term use, but for long-term everyday use, they do have side effects and can cause other issues as far as medical concerns. So, I mean, I recommend medicines for people who, like, if they get allergy tested and say they only have springtime allergies, so basically trees, and everything else is negative. Well, medicines are a good option for that patient because basically we can put them on medicines, control their allergy symptoms for the spring, and then once we're out of tree season, we can kind of get them off the medicines, and then they're good until the next year.
So are you talking about a cure for what these are?
I wouldn't. The word cure is thrown around a lot for allergies. It's really not, quote, a cure. I think immunotherapy offers you the best chance at total control of your allergy symptoms over a very long period of time. And I tell people, look, most of the time, you know, yes, allergies are bad in the Midwest compared to the coast where there's large bodies of water that help filter things out of the air. But the other thing about the Midwest is our allergies are fairly constant. We don't introduce a lot of new trees, flowers, and things, and that's because of our environment. I mean, very few things go to the humidity and temperatures we have now, to the minus numbers that we have in the winter time. So we have fairly stable flora and fauna. Whereas on the coast, things get introduced all the time where somebody may be doing fine and all of a sudden a new plant gets introduced and all of a sudden they're having symptoms. Well, that plant wasn't in their original test.
Right.
So now there's something else we have to
So
look
good
at.
news there, but if people want to start this process so that they can find some relief, what's the best thing to do?
Best thing to do is get an appointment and be evaluated because a lot of things, sinus problems, nasal problems, actually have an underlying allergy, etiology, or a cause that's driving it.
Okay, more information can be found at entclinicofiowa.com. Thank you both for joining us this morning. I know you're going to be a big answer for a lot of people's ailments this
And you're going to be very busy in the next month or two. All right, thank you.
Thank you.
It is 7:52. We will be right back.